Have you ever thought a simple fruit you enjoy every day could quietly increase your stroke risk overnight? Imagine this. You're doing all the right things. You take your heart meds, you eat fruits, you even swapped desserts for something healthier. But the very fruits you think are helping might actually be putting you in danger, especially if you're over 60 and on medications like aspirin or blood thinners. The truth is, some fruits, yes, even the natural, sweet, wholesome ones, can interfere with your medications in ways that most doctors never mention. They can spike your blood pressure, mess with your blood thinning, or throw your electrolytes off balance. And the scary part? These effects don't take weeks to build up. Sometimes they hit just hours after eating them. Today, we're diving into the fruits that might be harming your brain and heart health in silence. I'm not here to scare you. I'm here to help you protect yourself and your loved ones with the knowledge most people don't get until it's too late. Stay with me, because what I'm about to share could change the way you think about your fruit bowl forever. And hey, before we go on, let's make this a conversation. If you've ever been surprised by something healthy turning out not so healthy, just type 1 in the comments. If you've never had that happen, type 0. And don't forget to subscribe to Health 365, where we decode the truth behind everyday health choices. Now, let's start with one fruit that might seem completely harmless. But for some folks, it's a hidden risk. Grapefruit. It looks innocent enough, bright, refreshing, packed with vitamin C. Many seniors see it as a heart-healthy choice. But if you're over 60 and taking certain medications, this fruit could silently be putting you at risk, especially for stroke, internal bleeding, or dangerously low blood pressure. Here's why. Grapefruit contains chemicals called furanocoumarins. These block an important enzyme in your intestines known as CYP3A4, which plays a key role in breaking down many common medications, especially those used to control cholesterol, blood pressure, heart rhythm, and even anxiety. When this enzyme is suppressed, your body can't metabolize the medication properly. Instead of clearing it out gradually, the drug builds up in your bloodstream, sometimes to toxic levels. The consequences? You may experience side effects far more intense than intended. We're talking sudden drops in blood pressure, severe muscle pain, liver damage, irregular heartbeat, or life-threatening internal bleeding, especially for those on statins, calcium channel blockers, or blood thinners. This isn't just theory. The FDA has issued public warnings for years, and a study published in the Canadian Medical Association journal found that grapefruit can increase drug concentrations by up to 700%. Imagine your doctor prescribes a safe dose, then grapefruit turns it into 7 times that amount. That's not a side effect. That's a medical emergency waiting to happen. Consider this story. A 72-year-old man recovering from a minor stroke adds grapefruit juice to his daily breakfast, thinking it's a smart, healthy change. Days later, he notices easy bruising, dizziness, and stomach pain. By the time he reaches the ER, he's diagnosed with internal bleeding. No change in his medication, no new illness, just grapefruit juice. And this case isn't rare. Even half a grapefruit or a small glass of juice is enough to trigger the reaction. Worse still, the enzyme suppression doesn't wear off quickly. CYP3A4 can remain inhibited for over 24 hours, meaning that even occasional grapefruit consumption can keep your drug levels dangerously high, day after day. So what should you do? If you're taking statins, blood thinners, antiarrhythmics, or certain anti-anxiety medications, talk to your doctor or pharmacist. Ask specifically about grapefruit. Check the warning labels, even on supplements and multivitamins. And if you love citrus, switch to oranges or mandarins. They give you the zing without the risk. Now, let's move on to another seasonal fruit that may not be as heart-friendly as it seems. Persimmon. That soft, honey-like fruit so many of us associate with cozy fall desserts and traditional winter treats. It's rich in fiber, antioxidants, and natural sugars. But if you're over 60 and taking medications like aspirin, statins, or other blood thinners, this sweet fruit could quietly increase your risk of blood clots and stroke. Persimmons are high in tannins, plant compounds that give the fruit its characteristic astringency, especially when unripe. Tannins aren't just bitter. They can react chemically with proteins and medications in your stomach, forming sticky, glue-like masses. These masses can slow digestion, block the absorption of key nutrients, and, most importantly, interfere with the uptake of critical medications. For people taking antiplatelet drugs like aspirin or anticoagulants like warfarin, this means the medicine may not work effectively, leaving the blood prone to clotting. One study published in the Journal of Nutritional Biochemistry found that tannins in persimmons reduced the bioavailability of aspirin in test animals, meaning far less of the drug reached the bloodstream than expected. The implications for older adults are serious, especially when you consider that digestion and metabolism naturally slow with age. So the same dose of medication might already take longer to absorb. Add tannins to the mix, and you've got a dangerous delay. A 67-year-old woman managing heart disease with low-dose aspirin and statins. She reads online that persimmons are good for blood pressure and starts eating one every morning. Weeks later, she experiences slurred speech and blurred vision, a mini-stroke or transient ischemic attack. Doctors check her meds and labs. Everything looks normal. But when they dig deeper into her diet, they realize the persimmons were blocking the absorption of her blood thinners. What she thought was helping her heart was actually setting her up for harm. Unripe or even semi-ripe persimmons contain even more tannins, and unfortunately, grocery store labels don't always indicate ripeness clearly. You may not even realize you've eaten an unripe one until you feel that dry, puckered sensation in your mouth. By then, it may already be interfering with your meds. So, what can you do? If you're taking any medication for blood thinning or heart disease, it's best to limit or avoid persimmons, especially the astringent types. If you absolutely love them, talk to your doctor about timing your medication and meals carefully. Coming up next, a dried fruit that many people snack on daily, yet it may quietly raise the risk of kidney trouble and blood sugar spikes in older adults. Dates. Those sticky, sweet little bites often seen as a natural candy. They're loaded with fiber, potassium, and natural sugars, making them a popular snack, especially for people trying to avoid processed sweets. But here's the catch. For anyone with kidney problems or blood sugar issues, especially those over 60, dates can quietly raise your risk for stroke. Dates are incredibly high in natural sugars, about 16 grams per piece. That's more than what you'd find in a whole orange. For someone with diabetes or insulin resistance, this can cause a sudden blood sugar spike. These spikes don't just make you feel tired or foggy. They also increase inflammation in your blood vessels and raise blood pressure, two major contributors to stroke. But the real danger lies in their potassium content. Dates are packed with potassium, about 167 milligrams in a single date. Sounds healthy, right? Not if your kidneys are struggling. When kidneys aren't functioning well, they can't filter out excess potassium efficiently. High potassium levels can mess with your heart's rhythm, leading to arrhythmias or even sudden cardiac events, both of which significantly increase stroke risk. A study published in the American Journal of Clinical Nutrition highlighted how potassium overload in patients with chronic kidney disease led to a measurable rise in cardiovascular incidents, including strokes. That's not something you want from your afternoon snack. An older gentleman with mild kidney disease adds a handful of dates to his breakfast routine. He's proud. He's choosing a natural snack over pastries. But within weeks, he starts experiencing fatigue, muscle cramps, and irregular heartbeat. A blood test reveals high potassium, and his doctor warns him he was inches away from a serious cardiac event. So, what can you do? If you have diabetes, high blood pressure, or kidney issues, limit your intake of dried fruits like dates. Always check your blood sugar 2 hours after eating new foods. And if you love sweet snacks, try small amounts of berries instead. They're lower in sugar and much gentler on your system. Now, let's move on to another dried fruit that may surprise you. It's often seen as gentle on the gut, but too much of it can tip your body's balance in dangerous ways. Soft, chewy, and often recommended as a good source of iron and fiber. But hidden behind that golden glow is something that could spell trouble for your kidneys, and indirectly, your brain and heart. Dried apricots are high in oxalates. Oxalates are naturally occurring compounds that, in large amounts, can build up in the body and contribute to kidney stones. And for people with compromised kidney function, which becomes more common as we age, those oxalates don't get flushed out properly. They stay in the body, where they can cause inflammation, block filtration, and even contribute to chronic kidney damage over time. Why does this matter for stroke? Because the kidneys play a crucial role in regulating blood pressure and maintaining fluid and electrolyte balance. When the kidneys are inflamed or not working right, your blood pressure can spike. And that's one of the biggest risk factors for stroke, especially in seniors. A study in nephrology dialysis transplantation found that people with diets high in oxalates were significantly more likely to develop both kidney dysfunction and high blood pressure over time. What's worse is that most folks don't even realize dried apricots are rich in oxalates. They think they're doing something good, snacking healthy. But for some, that daily handful can quietly chip away at kidney health. Let's take an example. A woman in her late 60s starts eating dried apricots every afternoon to help with constipation. She's not on dialysis, but her kidney function isn't perfect. Months later, her doctor notices her blood pressure creeping up and orders tests. Turns out she's developed new kidney stones and her GFR has dropped. The hidden culprit? Oxalate overload from those seemingly harmless apricots. So, what can you do? If you've ever had kidney stones or have any kidney concerns, go easy on dried apricots. Stay hydrated, spread out your intake, and talk to your doctor about oxalate-rich foods. There are safer ways to get your fiber, like pears or cooked oats. Next, let's talk about another dried fruit that's often praised for digestive health, but can actually upset your body's electrolyte balance if you're not careful. You've probably heard they're good for digestion, and it's true. They help keep things moving, especially for those dealing with constipation. But here's the twist. Too many prunes can throw your body's electrolytes out of balance, and that's no small matter, especially when it comes to stroke risk. Prunes are rich in sorbitol, a natural sugar alcohol that acts like a laxative. That's great in small amounts. But when you eat too many, it can cause diarrhea, leading to dehydration and the loss of essential minerals like sodium and potassium. And when those electrolytes get out of whack, it can affect how your heart beats and how your blood flows, two critical factors in stroke prevention. It's not just about running to the bathroom more often. A study in the European Journal of Clinical Nutrition found that excessive intake of sugar alcohols like sorbitol could cause significant electrolyte imbalances, especially in older adults. These imbalances can lead to dizziness, confusion, heart palpitations, and even fainting, all warning signs of something more serious brewing beneath the surface. A retired man in his early 70s starts eating prunes every morning with breakfast and again as an afternoon snack. He's aiming for natural regularity, But after a few weeks, he begins to feel weak, lightheaded, and notices an irregular heartbeat. Lab results reveal low sodium and potassium levels, enough to land him in the hospital. All from something as innocent as too many prunes. Now, prunes in moderation are fine. But moderation is key. The recommended amount is about 4 to 5 prunes a day. Any more than that, especially on a daily basis, and you're inviting trouble. So, what can you do? Keep your portions modest. If you're relying on prunes for digestion, try alternating with high-fiber veggies, chia seeds, or even light exercise, which can help stimulate the gut naturally. And always drink plenty of water. Hydration helps your body handle fiber more smoothly and keeps those electrolytes balanced. Next up, let's explore a tropical favorite that might seem refreshing and harmless. But if you're on aspirin or blood thinners, it could be silently raising your bleeding risk. Pineapple, a fruit most of us think of as bright, juicy, and good for digestion. It's tropical, it's sweet, and it seems harmless enough. But if you're taking aspirin or any blood-thinning medication, pineapple could quietly increase your bleeding risk without you even realizing it. That's because pineapple contains an enzyme called bromelain. Bromelain has anti-inflammatory and mild blood-thinning effects on its own. Now, that might sound like a good thing at first. Why not help your meds along, right? But when you combine bromelain with aspirin, warfarin, or other anticoagulants, it can push your blood too far into the thin zone, increasing the risk of spontaneous bleeding, nosebleeds, or even internal bleeding. A 2012 review in Phytotherapy Research confirmed that bromelain enhances the effects of blood-thinning medications and can amplify their impact. And because bromelain doesn't come with a warning label at the grocery store, most people have no idea it's doing anything at all. Let me paint a picture. A woman in her 70s recovering from a minor heart procedure is taking aspirin daily as prescribed. Her daughter suggests pineapple juice as a healing tonic. After a few days of daily pineapple, she begins noticing bruises on her arms, bleeding gums when brushing, and darker than usual stools. Her doctor checks her coagulation levels. They're dangerously high. The mix of aspirin and bromelain turned her protective therapy into a serious bleeding risk. Even a few chunks of fresh pineapple or a small glass of juice can have an effect, especially when consumed consistently. It doesn't take a huge amount. So, what can you do? If you're on aspirin, clopidogrel, or other blood thinners, avoid large amounts of fresh pineapple and especially concentrated pineapple juice. Canned pineapple tends to have lower enzyme levels, but always check with your healthcare provider. And be extra cautious with supplements. Bromelain is often added to digestive enzyme blends and can go unnoticed. Now that we've covered all the sneaky fruits that could be putting your health at risk, let's take a moment to reflect and wrap things up with a warm, empowering message just for you. So, here's the truth. Not all fruits are as innocent as they seem. For those of us in our 60s, 70s, or beyond, what we eat interacts with our bodies in more complex ways than ever before. Medications, slower metabolism, and underlying conditions all mean we need to be just a little more mindful, even with something as natural as fruit. But don't let this worry you. Let it empower you, because now you know. Now you can read labels a little closer, ask your doctor sharper questions, and make choices that truly protect your heart and your brain. That's not fear, that's strength. That's wisdom. And that's exactly what keeps us moving forward, one informed step at a time. You deserve to enjoy your food without fear. With a few smart tweaks, you absolutely can. Have you ever heard a story that made your heart skip a beat? A neighbor, a friend, maybe even someone in your own family. Gone in an instant, struck down by a silent killer while simply watching TV or sleeping peacefully in bed. Every 40 seconds, someone in the US suffers a stroke. And for those of us over 60, the risk becomes alarmingly real. Imagine this. You're doing just fine, maybe enjoying your morning coffee or working on your crossword puzzle, and then suddenly, everything changes. But what if I told you that something as simple, as sweet, as ordinary as fruit could actually help protect you? Today, we're going to uncover something truly fascinating. This video isn't about miracle pills or complicated treatments. Instead, we're turning to nature, straight to your fruit bowl. Yes, your everyday fruits might just be your secret weapon against stroke. If you're over 60 and care about your health, or the health of someone you love, drop a quick 1 in the comments. If you're curious to learn more, or 0 if you've never even thought about fruit as stroke protection. And don't forget to subscribe to Health 365 so you never miss a tip that could literally save your life. Now, let's get into the first fruit that might just become your heart's new best friend. A tiny fruit that packs a giant punch. Blueberries. These little blue gems aren't just delicious tossed on your morning oatmeal. They're like nature's mini shield for your blood vessels. Blueberries are loaded with something called anthocyanins. Sounds fancy, right? But here's the deal. These are powerful antioxidants that give blueberries their deep blue color. More importantly, they help keep your blood vessels elastic and your blood flowing smoothly to your brain. A study published in the journal Circulation followed over 93,000 women for 18 years and found that those who consumed more anthocyanin-rich berries, like blueberries, had a 32% lower risk of heart attack. That's not a small number. It's life-changing. Now imagine what that means for stroke prevention. When your blood vessels are more flexible and your blood isn't thick or slow-moving, you reduce the chances of a clot forming. And less clotting means lower risk of a stroke. It's not just theory either. Researchers at the University of Cincinnati found that older adults who consumed wild blueberry juice daily for 12 weeks showed significant improvement in brain blood flow. That's a big deal when we talk about keeping your mind sharp and your body safe. So, what can you do with this info? Well, the next time you're at the grocery store, skip the sugary cereal and grab a pint of fresh blueberries, or keep a bag of frozen ones in your freezer. Add them to your yogurt, blend them into a smoothie, or just snack on them straight from the bowl. A simple handful a day could do wonders for your blood vessels and your brain. Now, from blue to bright orange, let's talk about another juicy friend your heart will thank you for. Something sunny and sweet. Good old oranges. They're more than just a source of vitamin C when you feel a cold coming on. In fact, they might be one of your most delicious defenses against stroke. Here's why. Oranges are rich in vitamin C, of course, but they also contain a lesser-known compound called hesperidin. This natural plant chemical works wonders inside your body. It helps reduce inflammation in your blood vessels, keeps your arteries flexible, and even supports lower blood pressure. And when your blood pressure is under control, your stroke risk drops dramatically. Let's talk numbers. A study from the American Journal of Clinical Nutrition found that people who consumed citrus fruits regularly had a 19% lower risk of ischemic stroke, the most common kind, caused by blood clots in the brain. That's nearly 1 in 5 strokes potentially prevented by adding a simple orange to your routine. But here's where it gets even more interesting. Oranges don't just help with stroke prevention, they're also linked to better cholesterol levels. Hesperidin helps reduce LDL, the so-called bad cholesterol, that can clog arteries and lead to dangerous blockages. That's double protection from one fruit. What's the takeaway? Try squeezing some fresh orange juice in the morning, just the natural kind, without added sugar, or peel one as a midday snack. And if you've got the time, Adding orange slices to your salad can be a refreshing twist that your heart and taste buds will both enjoy. Now let's move to a soft, sweet fruit that's almost always sitting in our kitchen. The humble banana, one of the simplest, most convenient fruits around. Bananas. They're soft, sweet, and ready to eat without any prep. But did you know that this everyday fruit can quietly help protect you from one of the most dangerous health threats we face as we age? The secret lies in potassium. Bananas are packed with it, and potassium is crucial for keeping your blood pressure in check. When your potassium levels are high and your sodium intake is low, your blood vessels relax, your circulation improves, and your heart doesn't have to work so hard. And it's not just a theory. The National Institutes of Health conducted a study showing that increasing potassium intake while reducing sodium can lower the risk of stroke by up to 21%. That's a big win from a small snack. They're not only high in potassium, but they're also low in sodium, which is the perfect combo for heart and brain health. And they're easy to include in your day. Slice one over your cereal, blend it into a smoothie, or just grab it on the go. Beyond potassium, bananas also contain vitamin B6 and fiber, both of which support cardiovascular health. B6 helps maintain healthy nerve function and reduces levels of homocysteine, an amino acid linked to blood clots and stroke risk when elevated. There's also evidence from the American Heart Association suggesting that diets rich in potassium can reduce the risk of cardiovascular diseases overall, especially for women post-menopause, where stroke risk tends to rise. Let's stay with creamy textures for a moment, because the next fruit isn't just delicious, it's rich in healthy fats that work overtime for your circulation. A fruit that's exotic, creamy, and loaded with surprising benefits. Soursop, also known as graviola. You might not find it in every grocery store, but if you do, don't walk past it. Because this spiky green fruit could quietly become your new ally in the fight against stroke. Soursop is rich in potassium and magnesium, two minerals that help regulate blood pressure and promote smooth, steady circulation. Just like bananas and avocados, these minerals help relax blood vessels, reduce strain on your heart, and lower your risk of clots, one of the main causes of stroke. But what really sets soursop apart is its impressive anti-inflammatory properties. This fruit contains powerful antioxidants, particularly acetogenins, which have been studied for their ability to reduce inflammation in blood vessels and protect the brain from oxidative stress. Chronic inflammation and oxidative damage are two silent drivers of stroke risk, especially in older adults. There's even early evidence suggesting that soursop may help improve blood flow to the brain. A study published in the Journal of Ethnopharmacology found that soursop extract improved blood vessel function in lab models, showing promise for its circulatory benefits. And let's not forget fiber. Soursop has a healthy dose of dietary fiber, which supports cholesterol balance and blood sugar control. Two more factors that, when managed, can significantly reduce your stroke risk. How can you enjoy it? If you find fresh soursop, scoop out the white flesh and enjoy it chilled, or blend it into a smoothie. Frozen pulp is also available in many international markets. Just be mindful not to overdo it. Soursop is powerful, and moderation is key. Now, let's talk about a fuzzy little fruit with a surprisingly powerful punch. The kiwi. It's bright green, tangy sweet, and usually the star of a fruit salad. But don't let its size fool you. This fuzzy little powerhouse has some serious benefits when it comes to preventing stroke. Kiwi is packed with vitamin C. More than an orange, actually. Just one medium kiwi provides over 70% of your daily vitamin C needs. Why does that matter? Because vitamin C helps fight inflammation, and chronic inflammation is a major contributor to high blood pressure and blood vessel damage, both key factors in stroke risk. But the benefits don't stop there. Kiwi is also rich in fiber and natural compounds called polyphenols, which support healthy cholesterol levels and keep your blood vessels functioning smoothly. What's more, it has an enzyme called actinidin that helps improve digestion and reduce oxidative stress in the body. Here's the really exciting part. A study from the University of Oslo found that eating just 2 to 3 kiwis a day significantly reduced blood clotting activity and lowered blood pressure in participants over time. That means kiwi isn't just good for you. It actively helps keep your blood from becoming too sticky, which is critical for preventing clots that could lead to stroke. So, how can you work kiwi into your day? Peel one and enjoy it after lunch. Blend it into a smoothie with some spinach and banana, or slice it on top of your yogurt for a little zing. It's a simple treat with powerful protective effects. Next, let's turn to another berry that's not just tasty, but could actually strengthen the very walls of your blood vessels. Let's talk strawberries. They're often seen as a symbol of summer and nostalgia, but beneath their charming appearance lies a quiet strength that can do wonders for your cardiovascular system. Strawberries are rich in a group of antioxidants called flavonoids. These plant compounds are known to help protect the inner lining of your blood vessels, keeping them strong and elastic. When your vessels are flexible and healthy, blood flows freely, and the risk of clots or blockages goes down, a key part of stroke prevention. What's more, strawberries contain a specific flavonoid called quercetin. According to a study in the American Journal of Clinical Nutrition, higher intakes of flavonoids like quercetin are associated with a lower risk of developing high blood pressure, particularly in older adults. That means a simple bowl of strawberries may be helping you more than you know. Another fascinating study from the Harvard School of Public Health found that women who ate at least 3 servings of strawberries or blueberries each week reduced their risk of heart attack by 32%. And while a heart attack and a stroke are different events, they share many of the same root causes, like poor circulation, plaque buildup, and blood clots. Protecting one means protecting the other. Strawberries also offer natural anti-inflammatory properties. Chronic inflammation is a silent contributor to artery damage and can increase the risk of stroke over time. These berries work behind the scenes to cool that internal fire and keep your system calm. So, what's a good way to enjoy them? Slice a few into your morning oatmeal, mix them into a spinach salad, or just snack on them fresh. Frozen strawberries work just as well and are available year-round, making this heart-healthy habit even easier. Now, let's turn to a fruit that adds a burst of tang and a touch of cleansing power. It's bright, it's zesty, and it's a quiet champion for circulation. Let's talk lemons. You might think of them as just something to squeeze into your water or drizzle over fish, but they're actually powerful allies in your body's fight against stroke. Lemons are bursting with vitamin C, one of the most important nutrients for reducing inflammation and supporting blood vessel health. But they also contain citric acid, which plays a unique role in improving blood flow. Citric acid has been shown to help prevent calcium buildup in arteries, keeping your blood vessels clear and reducing the risk of blockages. Here's something worth noting. A study from the Journal of Nutrition and Metabolism found that people who consumed lemon juice daily experienced lower blood pressure levels and improved blood circulation. Better circulation means less strain on your heart and brain and less chance for clot formation. Lemons also help thin the blood naturally. When your blood is too thick or sticky, it increases the risk of clots that can trigger a stroke, especially at night when your body is at rest and circulation slows. Drinking lemon water in the evening may gently support better flow and pressure regulation during sleep. And there's more. Lemons act as a gentle detoxifier. While detox is a word often thrown around carelessly, in this case it refers to lemon's ability to support the liver in filtering out toxins that can irritate blood vessels. When your body is cleaner inside, your vessels are calmer and inflammation stays down. How can you get more lemons in your life? Start your day with warm lemon water. Add fresh lemon juice to your salad dressings or flavor your meals with zest. It's an easy, refreshing habit. Now let's take a little trip to the Mediterranean with a fruit that's often mistaken for a savory snack: olives. Olives are incredibly rich in monounsaturated fats, especially oleic acid. This good fat helps reduce levels of LDL cholesterol while boosting HDL, creating a healthier environment inside your blood vessels. Cleaner arteries mean smoother blood flow, less plaque buildup, and a significantly lower chance of stroke. But there's more to olives than just healthy fats. They contain powerful antioxidants, including vitamin E and polyphenols like hydroxytyrosol. These compounds fight inflammation and oxidative stress, two key culprits in blood vessel damage and stroke risk. According to a study in the New England Journal of Medicine, older adults following a Mediterranean diet rich in olive oil and olives reduced their risk of stroke by nearly 30%. Olives also contain natural compounds that support blood pressure regulation. In particular, oleuropein, a bitter antioxidant found in olive leaves and unripe olives, has been shown to improve blood vessel function and reduce stiffness in arteries. So, how can you enjoy them? Add black or green olives to a salad. Pair them with fresh tomatoes and cucumbers for a Mediterranean-style snack, or enjoy a few with whole grain crackers in the afternoon. A small handful, a few times a week, could go a long way toward keeping your brain sharp and your blood flowing. You might think of it as just a trendy drink or a beachside treat, but coconut water holds real, measurable benefits for circulation and stroke prevention. Coconut water is naturally rich in electrolytes, particularly potassium and magnesium. These two minerals are essential for maintaining proper fluid balance in the body and keeping your blood pressure stable. When your electrolytes are in balance, your heart can pump more efficiently, and your blood vessels stay relaxed and open. One study published in the West Indian Medical Journal found that drinking coconut water significantly lowered systolic blood pressure in individuals with hypertension. That means it doesn't just keep you hydrated, it actively helps calm down those numbers on the blood pressure cuff, especially if you're prone to high readings at night. And there's something else coconut water does that's especially important as we age. It helps reduce blood viscosity. In simpler terms, it makes your blood less thick. Thicker blood is more prone to forming clots, especially during sleep when circulation slows. That's why strokes often occur in the early hours of the morning. Coconut water also contains cytokinins, plant hormones that have been studied for their anti-aging and anti-inflammatory properties. While the science is still emerging, early results suggest they may help protect blood vessels and tissues from age-related wear and tear. So what can you do? Try sipping on fresh coconut water a few times a week, especially if you live in a warm climate or struggle with nighttime blood pressure spikes. Just make sure to choose the unsweetened kind. Straight from the coconut is ideal. Now that we've explored these powerful fruits, it's time to bring it all together with a message of hope, action, and encouragement. So there you have it, 9 everyday fruits that quietly carry the power to support your heart, your blood vessels, and your brain. None of them are exotic or hard to find. They're in your grocery store, maybe even in your kitchen right now, just waiting to become part of your daily rhythm. And that's the beauty of it. Stroke prevention doesn't have to be complicated or overwhelming. Sometimes it starts with a single bite, a small decision that adds up day by day. You don't need to change everything overnight. Just pick one fruit from today's list and add it to your routine. Maybe it's a banana with breakfast, a handful of blueberries in the afternoon, or a glass of coconut water before bed. Each step counts. Remember, Your health is a journey, not a race. And the more love and care you give your body, the more it gives back to you, in strength, in energy, in peace of mind. Have you ever thought that something as healthy as an avocado could actually be working against your health? It sounds surprising, even a little unsettling. But it's true. While this creamy green fruit has earned its place as a superfood, especially among health-conscious folks like yourself, there are real risks hiding beneath its smooth surface. Risks that most people never hear about. And if you're over 60, some of these risks could affect you even more. Let's be honest, many of us add avocado to our breakfast toast, our lunchtime salad, or even a protein smoothie, believing we're doing something wonderful for our bodies. And in many cases, we are. But what if I told you there are 6 common mistakes people make with avocados that could quietly sabotage your health goals, or worse, lead to complications with your medications, digestion, or allergies? That's exactly what we're going to uncover in today's video. These aren't just casual tips. They're backed by science and years of nutritional research. And by the end, you'll not only understand how to avoid these pitfalls, but also how to get the most benefit from avocados without worry. So before we begin, if you're someone who eats avocados regularly, I'd love to hear how you usually enjoy them. Comment below and tell me. And if you care about your health and love learning these science-backed insights in a calm, clear way, don't forget to subscribe to Health 365. You'll be joining a warm, supportive community focused on aging wisely and living fully. Now let's dive into the first big mistake that most people, especially older adults, make with avocados. It has to do with a hidden natural toxin that almost no one talks about. There's a natural compound found in every part of the avocado plant called persin. It's not printed on labels, not mentioned in recipes, and hardly anyone talks about it. But it's there, inside the leaves, bark, seeds, skin, and yes, even in the flesh that we eat. Now don't worry just yet. Persin in ripe avocado flesh is present in very small amounts, and for most healthy people, it doesn't pose an immediate threat. But if you eat avocados often, or every single day, it's something worth knowing. You see, persin is a natural fungicide, a defense mechanism the plant uses to protect itself from pests and mold. But in our bodies, especially if we're more sensitive or have liver issues, that same compound can cause subtle trouble over time. A lab study published in a toxicology journal showed that avocado extract caused DNA damage in white blood cells in a petri dish under controlled conditions. Now, that doesn't mean eating avocado will damage your DNA, but it does remind us that even natural foods contain compounds we should respect, not overuse. Especially as we get older, when our liver function can slow down and our tolerance for certain plant chemicals may decrease. What's even more concerning is what persin does to animals. In birds, it can lead to heart problems or even death. In mammals like goats or horses, it can cause swelling of the mammary glands and heart failure. Humans are more resilient, of course, but we're not immune. If you've been eating avocados daily and start noticing things like fatigue, digestive upset, or skin changes, it may be worth taking a short break and seeing how your body responds. That's why many nutritionists now recommend what they call a 5-on, 2-off approach. Eat avocado for 5 days, then take 2 days off. It gives your body a chance to process and recover, especially if you eat other foods that also contain plant compounds. In short, even something as healthy as avocado deserves balance and awareness. We'll talk about another surprising avocado danger in just a moment, and it's one that's quietly causing weight gain in people who thought they were eating clean. Now, let's talk about another trap that sneaks up on a lot of health-conscious folks: calories. Yes, Avocados are full of heart-healthy fats, fiber, and important nutrients, but they're also surprisingly calorie-dense, and that can quietly sabotage your health goals, especially if you're watching your weight, blood sugar, or heart health. Here's the truth. Most people don't realize one large avocado contains about 320 calories. That's more than a full bowl of pasta or 2 slices of pizza. Yet, many of us treat avocados like a free food. We spread them on toast, toss them into salads, blend them into smoothies, or even eat one plain as a snack. And it adds up fast. You might think, but it's a good fat, right? Absolutely. It is. The monounsaturated fat in avocado is one of the best types of fat for your heart. But your body still sees calories as calories, whether they're coming from cookies or avocados. And when you're in your 60s or beyond, your metabolism naturally slows down, which means every extra bite matters more than it did a few decades ago. Research actually supports this balance. One large clinical study followed people who ate one avocado every day for 6 months. Their weight didn't go up, but only because they were carefully portioning and substituting, not adding it on top of everything else. In other words, they didn't add an avocado to an already big sandwich or salad. They used it in place of other fats, like mayonnaise or cheese. So, what's the right amount? Most nutrition experts suggest about 1/3 of a medium avocado per serving. That's roughly 50 grams or 80 to 100 calories. But here's what really helps. Track your intake for just 1 week. You may be surprised at how often that innocent-looking green fruit shows up on your plate. If you've been eating half or even a whole avocado every day without adjusting other parts of your diet, it could explain why the scale isn't moving, or why your clothes feel tighter even though you're eating healthy. Remember, avocados aren't the enemy, but even the best foods can work against us when we go overboard. Up next, let's talk about a risk that's even more serious and could affect you without you knowing it, especially if you've ever had a reaction to latex. Now here's something many people have never connected to avocados, but it could be one of the most dangerous risks, especially for those with hidden allergies. It's called latex fruit syndrome, and if you've ever reacted to rubber gloves, balloons, or medical equipment, you need to pay close attention. Latex fruit syndrome is a condition where people who are allergic to natural rubber latex also react to certain fruits and avocado tops that list. The reason? Both latex and avocados contain similar proteins that can confuse the immune system. So even if you've never had a full-blown allergic reaction, you may still have a sensitivity that's been flying under the radar. Doctors have found that up to 50% of people with latex allergies also react to avocados. That includes people who work or worked in healthcare, cleaning, food service, or even gardening. Jobs where contact with latex gloves or rubber products is common. Sometimes the allergy develops slowly, with symptoms that feel mild at first: a tingling mouth, a scratchy throat, or swelling in the lips after eating avocado. But it can also escalate quickly. Some folks experience full-body hives, difficulty breathing, dizziness, or even anaphylactic shock, a life-threatening condition that requires immediate medical attention. And because so few people realize the connection between latex and certain fruits, these reactions often go misdiagnosed or misunderstood. If you've ever had a strange or uncomfortable feeling in your mouth after eating avocado, or if you've had a reaction to latex, you may want to speak with your doctor about getting tested. It's better to be safe than sorry, especially as our immune systems change with age. And here's one more tip. Many other fruits share this cross-reactivity, including bananas, kiwis, and chestnuts. If you've had trouble with any of those, avocado might be on your personal watch list too. Of course, not everyone is at risk, But this is exactly why it's so important to understand how your unique body responds to certain foods. What's safe and healthy for one person can be risky for another. Next, we'll explore another avocado mistake that has nothing to do with allergies or calories, but everything to do with how you cut and store them. And trust me, it's a safety issue many people overlook. It might seem like common sense, but many people, especially those who love fresh produce, don't realize just how easily avocados can become contaminated. And unfortunately, the way most of us cut and keep them may be setting us up for serious foodborne illnesses. You see, avocados grow in warm, humid climates, perfect conditions not just for the fruit, but also for bacteria like Salmonella, E. coli, and Listeria. These bacteria don't just sit on the skin. They can cling deep into the rough outer surface, finding small crevices where they're protected, even from a quick rinse. Now here's the real problem. When you slice an avocado without washing it first, your knife can pick up those bacteria and drag them straight into the flesh, the part you're about to eat. And because avocados have such a mild taste and creamy texture, you probably won't notice anything wrong. Spoiled or contaminated avocados often look and taste completely normal. Even more concerning, once an avocado is cut, it becomes a perfect breeding ground for bacteria. Its high moisture and fat content, combined with being left out at room temperature, allows germs to multiply quickly. Food safety experts call the range between 40 degrees and 140 degrees the danger zone. Within this range, harmful bacteria can double every 20 minutes. So what can you do? Start by always washing your avocados under cold running water for at least 30 seconds before cutting, even if you don't plan to eat the skin. Use a clean knife and cutting board, preferably ones that haven't touched raw meat or unwashed produce. Once the avocado is sliced, refrigerate it right away in an airtight container. Never leave cut avocado at room temperature for more than 1 hour. Whole avocados can be stored at room temperature until they ripen. But once ripe, they should go straight into the fridge and be used within 5 to 7 days. And if you've ever scraped off the brown part and thought, "It's still good underneath," just be cautious. That discoloration could signal spoilage that's not visible or safe. Taking these simple steps makes a big difference, especially for older adults who may have a slightly weaker immune system and less resistance to foodborne bacteria. Now that we've covered food safety, let's talk about another silent danger, one that has nothing to do with how you cut an avocado, but everything to do with the medications you might be taking. Now, here's where things get a little more serious, especially if you're on daily medications, like many people over 60 are. Did you know that something as innocent as avocado can interfere with your prescriptions? Most doctors don't mention this, and it's rarely printed on a label. But certain compounds in avocados can change how your medications work, sometimes in dangerous ways. Let's start with blood thinners, like warfarin, Coumadin, or newer ones like Xarelto or Eliquis. These medications help prevent clots and strokes, but they rely on you having a consistent intake of vitamin K. Not too much, not too little. And here's the twist. Avocados contain moderate amounts of vitamin K. If you suddenly start eating them every day, you might throw off the delicate balance your doctor worked hard to establish. Too much vitamin K can cancel out your blood thinner, increasing your risk of a clot. But if you suddenly stop eating vitamin K-rich foods like avocado after having them regularly, your blood could become too thin, putting you at risk for bruising or internal bleeding. But that's not all. Avocados are very high in potassium, even higher than bananas. 1 cup contains around 975 milligrams of potassium. For most people, that's great for blood pressure. But if you're taking medications like ACE inhibitors, ARBs, or potassium-sparing diuretics, this can lead to hyperkalemia, a condition where potassium builds up in your blood. That can cause irregular heartbeat, muscle weakness, or in severe cases, cardiac arrest. Even if you're managing diabetes, you should proceed with care. The fiber in avocados can slow down absorption of some oral diabetes medications, potentially making them less effective. Meanwhile, their healthy fats can actually enhance insulin sensitivity, which sounds helpful. But in some cases, it might cause unexpected drops in blood sugar, especially if you take insulin or sulfonylureas. This doesn't mean you have to stop eating avocado, but it does mean you should talk to your doctor before making them a daily habit. Let them know how much you eat and how often, so they can help adjust your dosage if needed. And now, there's one final risk we haven't covered yet, one that's especially personal and easy to miss. It's not about toxins, calories, or medicine. It's about how your own body reacts to avocado in ways you might not even recognize. You see, even if avocados are packed with healthy fats and nutrients, they're not a perfect fit for everyone. And for some older adults, they may cause subtle, but very real, problems that are easy to miss or misinterpret. Let's start with digestion. A whole avocado contains over 13 grams of fiber. That's a lot for one sitting, especially if your digestive system has slowed down a bit with age. For people who aren't used to eating a lot of fiber, or who deal with sensitive stomachs, IBS, or sluggish bowels, this can lead to bloating, gas, cramps, or even sudden shifts between constipation and diarrhea. And it's not just the fiber. Avocados also contain sorbitol, a type of sugar alcohol that falls under the FODMAP group, a group of compounds known to cause digestive trouble for those with irritable bowel syndrome, IBS, or small intestinal bacterial overgrowth, SIBO. Even a few spoonfuls of avocado can trigger discomfort that lasts hours or even days for those with FODMAP sensitivity. Some folks also react to the histamines in avocado, especially when the fruit is overripe. If you've ever felt itchy, flushed, headachy, or noticed skin rashes after eating avocado, you may be dealing with histamine intolerance, which becomes more common as we age. Then, there's something called oral allergy syndrome, a mild allergic reaction that happens when your body mistakes proteins in avocado for pollen allergens like birch or ragweed. You might feel a tingling or itchy mouth, lips, or throat. It's usually mild, but it can be uncomfortable and confusing if you don't know what's causing it. And here's the kicker. Some people, due to their genetics, don't process fats or plant compounds like persin as efficiently. Combine that with age-related decline in enzyme production, and suddenly, a food that's healthy on paper becomes harder for your body to handle. So how do you know if avocado is affecting you? The answer is simple, but powerful. Pay attention. Keep a little food journal. Track what you eat and how you feel over the next 24-48 hours. If you start noticing patterns, digestive changes, skin issues, unusual fatigue, it may be your body's quiet way of asking for less. And now that we've uncovered all 6 of these hidden risks, let's bring it all together and talk about how you can still enjoy avocado safely and confidently, without fear. Because yes, when done right, it is still one of nature's best foods. So, yes, avocados can still be one of the healthiest foods on your plate, if you treat them with the care and respect they deserve. Like so many things in life, it's all about balance, awareness, and listening to your body. We've talked about the 6 key mistakes, from ignoring the natural toxin persin, to overeating and hidden allergies, to medication interactions and storage safety. But the truth is, when you enjoy avocados in the right amount, prepared safely, and in a way that suits your body, the benefits are still remarkable. Better heart health, improved nutrient absorption, and even protection for your eyes and brain. If you're new to eating avocado, start slow. And if you've been eating them daily, maybe take a short break or adjust your portion. There's no one-size-fits-all, only what works best for you. Now I'd love to hear from you. Have you experienced any strange symptoms after eating avocado? Or do you have a favorite way of preparing it that's worked well for your health? Leave a comment below and share your story. It might help someone else. And if you found this helpful, please subscribe to Health 365. We're here to help you age wisely, eat well, and feel empowered every single day. More practical, science-backed videos are coming soon. See you in the next one.